How soon after the patient sits down in your chair and starts telling you why they came in for an exam, how soon after that do you start talking? And in many cases, maybe even interrupt the patient. So there's been some interesting research done on this, and one in particular was from a book called How Doctors Think by Dr. Jerome Groopman. And they wanted to find out what's the average time that doctors will jump in after a patient starts talking. And on average, they found it was about 18 seconds. And I've seen similar research done elsewhere, and the numbers vary a little bit, but every time I've seen it, the number was less than 20 seconds. And in many cases, it actually prevented the patient from fully disclosing their reason for coming in. The thinking behind this was that when doctors feel like they have enough information, then they just start jumping in with the solutions. So I want you to contrast that with something from a somewhat different industry, the world of sales, where they did some research with salespeople on sales calls, and they wanted to find out what were the top characteristics of the higher performing salespeople. What they found out was the number one characteristic of the highest performing salespeople were they were the ones doing the least amount of talking. So it's an interesting dichotomy, right? In one scenario, I'm assuming that I understand what you're going through. I understand the problem, and I'm telling you what to do. And in the other scenario, I'm giving you the space to describe the problem in your own words as you perceive it. So it's a big difference, right? Now, I know the pushback on this will often be, well, we don't have a lot of time. It's a very busy practice. We don't have a lot of time to be asking all these questions, to be doing all this so-called listening. But I'm not really asking you to take more time. Maybe just reprioritize how you're spending the time in the initial interactions with the patient. Because I think you'll find if you spend more time on the front end, asking more questions and doing more listening, you might find that it actually takes less time when you go to make your solutions, your recommendations, your prescriptions, because you can be much more focused at that point. And I would ask you to consider you as the patient. What would you rather have? A doctor that just asked a couple of questions at the beginning and then jumped in with with what they thought was best for you, where you might risk having a disconnect. A lot of people feel like their doctor really didn't listen to them or didn't understand them, or a doctor that took a lot of time in the beginning to listen to you and really understand you, and then could be very focused in what they presented as far as their recommendations or solutions. So I hope that helps. Just give some thought to how you're spending your time with patients and if you're doing enough listening.